Immunomodulation in follicular lymphoma has a very strong future, and it's a very rational choice because of the effect of the tumor microenvironment in follicular lymphoma. The MD Anderson Cancer Center first demonstrated that patients with follicular lymphoma treated with lenalidomide and rituximab did very well. Their overall response rate was almost 100%, which is very, very promising. The CALGB also looked at the combination of lenalidomide and rituximab, and they too showed that the combination was very promising with progression-free survival that was very high, about 89% at 2 years. The ongoing relevance study is looking at lenalidomide and rituximab as well in a randomized study compared to other chemotherapeutic regimens for the frontline setting. So I think that this is looking at possibly impacting on a new frontline approach or a new frontline choice for patients that is a chemo-free or non-chemotherapy containing approach for the patients that have newly diagnosed disease that are in need of therapy. The key findings from the Alliance trial, which looked at lenalidomide and rituximab in previously untreated follicular lymphoma, is that the 2-year progression-free survival was 86% in those patients, and the overall response rate was 95%. Importantly, at 5 years, overall survival was 100%. So I think this demonstrates that the frontline use of lenalidomide or rituximab is very promising.
R-squared, or lenalidomide and rituximab, has been looked at in many different settings and many different indications. As I mentioned earlier, it's been looked at in the frontline in follicular lymphoma. It's been looked at as in relapse disease with follicular lymphoma. And at this meeting, we also saw lenalidomide and rituximab used as maintenance therapy following bendamustine and rituximab induction. This is part of the Bionic trial. This was a cooperative group trial that looked at basically 3 arms in patients with follicular lymphoma. There was an arm with bendamustine rituximab, followed by lenalidomide rituximab maintenance, bendamustine rituximab with rituximab maintenance, as well as bendamustine Velcade rituximab with rituximab maintenance. This study showed very similar findings between all 3 arms. And what that means is that bendamustine rituximab with rituximab looked about the same as bendamustine rituximab with lenalidomide rituximab maintenance. And unfortunately, there was increased toxicity with lenalidomide rituximab following bendamustine rituximab. So that's a very complex way to say that I think that at least in this trial, there did not appear to be a benefit of lenalidomide rituximab following bendamustine compared to just rituximab alone.